Childhood should be about learning new things, making friends, endless curiosity, and simply enjoying life. But unfortunately, without proper care and treatment, the experience of child sexual abuse can have an impact that lasts a lifetime. The impact of sexual abuse can be devastating, not only for survivors, but also those close to them and their community. At the CAMC Children's Advocacy Center, our mission is to provide competent, child-centered care for children and families affected by child abuse, and to help everyone on their path to healing. Child abuse, specifically child sexual abuse, is much more common, I think, than what people believe. Nationally, statistics say that by the age of 18, 1 in 10 children will be the victim of at least one type of child sexual abuse.
People are not aware of how common it is. It transcends race, socioeconomic levels, and people are surprised to hear how many patients that we see in the Child Advocacy Center on a regular basis.
The long-term effects of child abuse really depends on the particular child and the age of the child and the circumstances of the abuse. It really can vary quite a bit, ranging from fears and nightmares to depression and sadness, relationship difficulties, behavioral problems, shame and guilt. It really can run the whole gamut of emotional and social difficulties.
It's important that we help identify those factors. It's important that children are surrounded by people who believe them and care about them, and those are things that go a long way in helping children have long-term successful recovery from what probably is the most awful experience they'll ever have in their life. I think it's really important when children arrive at our center to know that our place is a safe and friendly place for them to be. A Child Advocacy Center is designed to be a sort of one-stop shop for the evaluation and treatment of children who we believe have been victims of child abuse. The majority of kids that we take care of are those who we have concerns for child sexual abuse. So once kids come through our door, there's a number of different services that we provide. The family is going to meet with our family advocate.
My role is to meet with parents to provide them with resources that their children and family need to help them get through the process after a disclosure is made. Most parents are really worried about their child, and so my goal is to listen to them first of all and to reassure them that we're going to be there for them and their child, and to provide them with support and any resources they may need to help them after they see us.
Children are then introduced to our forensic interviewers, who will then conduct an interview with children to try to determine what, if any, kind of abuse has happened to them. All of our staff who conduct interviews at our center are trained in a national model to conduct those interviews in a non-leading and objective way. Once an interview has been completed, then the child will go to the next room where they'll have a complete medical evaluation by one of our child abuse pediatricians.
My job at the Child Advocacy Center is to do a medical evaluation of the child. So depending on the age, I may talk to the parent first, but the older children, I actually talk to them and go over their medical history. When I begin the exams, I reassure them that I'm not going to do anything that hurts. I let them know they're in control, and we make a deal that they're the boss of themselves there, and that if there's anything that they don't like, they can just tell me.
Once the interview and the exam are over, then we as a team will collectively meet with the parent or the child's caregiver to talk with them about what our findings are, and then reiterate to them the recommendations that we have based on what we identify as needs for their child and their family.
As the medical expert, my job is to find out what happened and how it happened. So if a child needs to be kept safe, then they are. But I also am there to make sure that parents are falsely accused of something. The court relies on me to give them the most up-to-date information around that particular area, whether it's physical abuse or sexual abuse. I testify to the findings and explain to the court and to the jury what the final opinion is.
Oftentimes when children leave our center, they want to know if they're going to get to come back. And so that's one of the advantages of having on-site mental health services too, because some of the children that we see and evaluate then later will come back, and they're always happy to see staff. And I think they just see us as a place that cared about them and believed them and helped them get on a path to healing.
When children come to therapy at the Children's Advocacy Center, they generally have already been seen at the CAC for both a forensic interview and a medical examination. So they're familiar with that space, they're familiar with the people there, they feel a comfort level and a trust in that safe space. So then the therapist focuses mostly on development of coping skills, because we know that child abuse can bring up a lot of big and overwhelming feelings, and if children don't have the tools to cope with that in a healthy way, that can lead to them being completely overwhelmed by those feelings or acting in ways that might not be the most healthy or helpful.
I feel really fortunate that the Child Advocacy Center is part of Women and Children's Hospital and Charleston Area Medical Center. We've always had a deep commitment to taking care of children who have been victims of not just sexual abuse but physical abuse. Every time we've had a need for additional resources, we've had a need for additional space to provide services to kids and family, they've always answered the call. We've always been able to figure out a way through the CAMC Foundation, through various donors in the community, to make sure that we have the staff and the resources and the ability to take care of the most vulnerable citizens that we have, our children. It's important for families to realize that their visit to our center is not the end, but in many ways just the beginning. Our goal at the Children's Advocacy Center is to give every child that comes through our doors the best possible chance for growing up to lead a happy, healthy, and fulfilling life. Child sexual abuse can be a very traumatic time in a child's life, but it doesn't have to define it. We are committed to providing children with the care and the resources they need to heal. So as long as the need exists, we'll be here to welcome children with open arms and help them find their way back to a life that allows them to look forward to the possibilities of tomorrow.